the grad studies survey that's underway. And really what she's going to do is set some of the tone now for what we're going to be doing next. And that's thinking a little bit more about our program and our department and where we are in terms of current state and where we want to go in terms of future state. So I think that these results will be really helpful as we start to think in that light. So Tara, come on up and help yourselves to food. If people want some additional food, we'll be having a dinner break at about 5:15, 5:30 or so. But if you need some snacks, help yourself.
So my takeaway from the last talk is that I should be very afraid of being up here speaking to all of you. And yes, and I appreciate the fact that I stand between you and dinner. So when Brenda asked me to talk at the retreat, she asked me to look at, achieving the top 5 and where do we stand. And my focus is on graduate science education and the graduate programs, and the data that I'm going to be showing you is focusing on the master's and PhD in community health science. But the messaging that I'm going to give you at the end is applicable to all of your training programs and really an extension of your research. So while I am coming at this from a graduate perspective, please keep these ideas in mind for all of the educational portfolios in the community health science. And before I go on, I really do have to give a big shout out and kudos to your graduate program director, Elizabeth. She has done an absolutely fantastic job. A lot of the successes that I'm going to talk about are due to all of her incredible hard work and efforts. So framing this talk, achieving the top 10, where do we stand? And really what I'm going to pose to you is where we are now and where we want to go. And I'm not going to answer the question of where we want to go. That's up to you guys to decide, knowing that my office and myself are here to support you. But I'm not here to define what that vision is for you. But I'm hopefully going to pose some key thinking points and talking points at the end that will hopefully help you in the breakout discussions and things that you should think about. I am not going to talk about the curriculum review that is sort of ongoing and will be really taking off in the winter and spring. What I am going to talk to you is about data that has been collected during the Graduate Science Education Unit Review. And I'm not going to share all of the data with you. I'm only going to focus on community health science. And I'm only giving you a snapshot of that data. But I think it's really important to give an idea of what the institution measures when they're looking at success and the achievements of a program. And we can argue whether or not those are the right things to look at or not later on at the end of the talk, and just kind of to give you a framework of where we're going. I also have to apologize. I am not very good at Excel. And I'm not very good at PowerPoint, and I have no idea how to make data look exciting. So I will try to act excited so that emotion is then projected onto you. So I apologize for my really boring slides, but I'm really not sure how else to present these things. So what this is enrollment. Is there a laser? Okay. Enrollment going from 2011, 2012 up to 2015, 2016. These are the academic years. The charts were looking really confusing when I was putting too many numbers on them. And what we have here is your course-based masters in CRDS. These blue bars are your Masters of Science, purple bars are PhD, and these brownish bars are the total number of graduate students that you've had over the years. And as you can see, enrollment has been steadily increasing over the years, definitely not dropping. And in an economy and in a funding situation where we might not be able to take on as many students, it's actually really, really refreshing to see that these numbers are continuing to remain steady or at least go up. This is your current status right now. You have a total of 162 students, and they are obviously over your 7 specializations. We have some rather large specializations, including epidemiology, some smaller specializations like CRDS and biostats, and I know that biostats is working very hard to synergize with math and stats to increase those numbers. And there's also some diploma and certificate initiatives coming out of computer science and community health that will also hopefully augment some of these numbers going forward. But all in all, you're a fairly large graduate program. You're the largest graduate program in the Cumming School of Medicine. And that is both positive, but as you can all appreciate, also comes with its challenges. So, this is just gender distribution from 2011 to 2015. You were highly imbalanced. Favoring female graduate students over male graduate students. I don't know what this means. These are just statistics and metrics, but it is things that the university looks at. So at least at the graduate education level, we do just fine in equity, at least amongst gender. This is the percentage of our international students. In red is community health science, and in blue is the Cumming School of Medicine. With respect to international students, you're actually quite low. And the reason that I point this out has to do with the context of the internationalization strategy in the school and in the university, where we are trying to get an internationalization population of around 25 to 30% at the graduate level. We are there for the Cumming School of Medicine overall. Community health science doesn't contribute to that substantively. Again, I'm not saying that you have to go out and do some action plan to recruit international students. This is simply to show you a snapshot of where you're currently at. This is your total degrees awarded, and as you can see, 2011 to 2015, we're actually, pretty steady, doing pretty well. 2012, I believe this spike was when medical education joined community health sciences from the medical sciences program, so there was a bit of a shift in spike there. But all in all, you're doing very well. And your PhDs and masters tend to be pretty steady. You're actually seeing a slight increase in the number of PhDs you're graduating, which I think is a good thing. A little bit of a decrease in the masters, but nothing, they're just like blips on the radar, in my opinion, and nothing that is concerning. Graduation rates. Again, now this is, your PhDs are a little bit lower. You've got a 65% graduation rate. I also have to say, this is your 90. So the number of students that have graduated 9 years after starting. So if they're not there by 9 years, they're probably not going to graduate. And that's the same with your five-year masters. There is some ambiguity to some of this data. The way the Office of Institutional Analytics calculates all of this, sometimes when I look at it, my gut tells me it's not real, and my gut tells me this isn't real. I know how many students have withdrawn over the past 5 years from every single program, and this number doesn't make a lot of sense. However, but this is what we get judged on. So I'm working to work with the office, through Faculty of Graduate Studies, the Office of Institutional Analytics. I think that these numbers are a little bit higher than they're showing. But that being said, even if I look at the raw numbers, you do have slightly more students falling off at the PhD level than the master's level. I think we can all understand why that might be the case. You're in 5 years, 7 years. It's a long haul. You have a lot of students in your program that aren't what I would consider, and I'm going to use the word typical because I'm a biochemist, to the lab-based programs. As Tom pointed out earlier, you have working professionals who want experience, they want coursework. They might not need that degree, and so once they get the information they need, and I'm just speculating here, this is not my area of expertise, but this might be indicative of something where we really have to look at are we providing the right training environment to the students you're trying to attract? And rather than trying to make our students fit into the programs that we currently have, should we be revisiting the way we run our programs to meet the needs of your students? And really, that's all I take from this type of data.
Is it really a positive way we see this? It's because we are cultivating high, because everyone graduates, really high bar, and then we make them
There's
really high quality.
As I said, I'm not overly concerned about the data, but yeah, you do have, and you should have, and when you think about things where people fall off, do they fall off at a candidacy exam? Well, not every PhD student should be passing their candidacy exam. That's actually, I think, a good thing. That shows rigor, that shows standards. So I think that there's lots of things that can be taken as a positive from this.
There was a time when after the maximum length of time for PhD, whatever it was, 6 years.
6 years.
That we didn't get counted? Is that what some of this is? Because you said
no.
9 years.
So this is, to the best of my understanding, the graduation rate 9 years after admission to program. Because when I first, so that they show this data a couple of different ways. I've tried to show it the most accurate way, where they had a 5-year PhD rate and a 2-year master's rate. Well, of course, we're not going to have as many people graduating. The graduation rate would look lower because not everybody, and I'll show you times to completion, most master's students don't graduate in 2 years, and most PhD students don't graduate in 5. So I've shown you the 9-year and the 5-year because most people should be through at this point in time.
So, Tara, and is this for like the leaders in medicine program? Because if a student did a 3-year master's degree and then a 3-year medical degree, they wouldn't technically get their master's degree until 6 years afterwards.
But that shouldn't be taken. But they should be graduated within that 9 years.
For PhD, but not necessarily for masters.
Maybe not, but maybe not, but it would for the PhDs.
Yes.
Are other programs achieving high graduation rates and we're not? Or is
Are
this
there,
typical of the rest of the CSM?
This is pretty typical of the rest of the CSM.
I think it's probably the data.
Yeah. Yes. Yeah.
I think those graduation rates are partially a reflection of the challenge of admission and selection criteria. The very, very difficult task you face in selecting the right students.
Absolutely. Yeah, and I think that goes back to Huda's point that, maybe this is not necessarily a bad thing.
If somebody converts to a master's, from a PhD to a master's, is that taken care of?
You still only have 6 years.
Yeah, but are they then in the master's group?
No, they're in the PhD group.
Yeah, so, and they won't finish their PhD, so...
But they're then considered PhD students.
No, but convert. I mean the other way around. So from PhD.
That's taken. Yeah, so that's considered success at a master's level, according to the Faculty of Graduate Studies. Because I asked that question. I specifically asked that question. If we were losing transfer students, because we all see that as a positive, we want to make sure that the institution doesn't see that as a negative. And I have been told that they don't. So this goes to time to completion. 2011, I have no idea what happened. Your times to completion were over 6 years for a PhD and almost 3 years for a master's. We are now, 2015, 2016, much more online with the 5-year PhD, 2.5-year master's. I don't have a good feel for how that compares to comparable community health science, epi, stats, and I'm not going to list all of the specializations across the country. This is actually lower or right on par with other programs in the Cumming School of Medicine. So one of the other things, in addition to all of the stats about, time to completion enrollments, is every 3 years across the country, the students are invited to complete the Canadian Professional and Graduate Student Survey. And this really captures how happy these students are with their program. And obviously, you're depends on who decides to answer the survey, what the response rate is. But it is a measure of how pleased or displeased the students are with the program. So what I was able to do was capture data from 2010, 2013, and 2016. They differentiate between master's and PhD students. and this is just a snapshot, I have pages and pages and pages of data, as were the other ones, snapshots. Like if you want more detailed data, I could talk for hours about all of the graphs and charts that we've been provided with. But essentially, 2013, there was a little dip in student life experience. I'm not exactly clear. So this is, and I put these down because this is actually how the question is worded. How would you rate the quality of your student life experience at the university? And how would you rate the overall quality of your overall experience at this university? But these are what you get. So you have just greater than 80 and greater than 85% for student life experience, a little bit below 85% for a master's degree, really high overall experience satisfaction for your PhDs, which I actually think is remarkable, especially considering, depending on the time of year or the time in program, a PhD student might fill this out, like post-candidacy, right when like they're not being very productive and the world's going to end, they might be very negative. But I would say overall, you've definitely gone up for your PhDs, and a greater than 90% overall experience, I think, is really a fantastic result. This is student satisfaction with the program. And for some reason, they separate it into academic and administration. But again, we're well over the 85 and in some cases over 90% for the academic portion of your program. And we're between 80 and 85% for the administration part of your program. So again, these are really high, especially when you compare. What the survey does do is it compares across the university, across the Cumming School of Medicine, and you are on par or higher in overall student satisfaction with respect to the comparators to the university. Satisfaction with the supervisor. It's still this scale. Okay, so to take into account this scale, slightly lower satisfaction with the supervisor compared to 2013 and 2010. However, you're still at over 85%. So, lots can happen. As Gordon said, there's lots of things that can happen between a supervisor and a student not getting along. There can be lots of reasons for that. You have an increased number of students, which also means there's an increased chance of things going wrong, which would elevate something like this. But as I said, watch the scale because you're still clearly greater than 95, close.
Really hard work to do.
Pardon?
If we give too much work to do.
Yeah. Well, they'll always complain about that. But as I said, overall, you're almost at 90%, just a little bit of a decrease from 2013 to 2016. Okay, scholarship success. Elizabeth did mention this. So we have in the office analyzed all of the incoming money to each of our students that is outside of supervisors' operating grants and I can't remember if internal university scholarships are included in this number. I'd have to go back and check. But anything outside the university, foundations, tri-council, everything. And you are doing absolutely phenomenal in bringing in scholarship support for your students. Yes. It has increased every year. And over the past 4 years, you have brought in more than $5 million in student funding, which is absolutely phenomenal. You have 9 Vanier awardees, 3 Governor General Gold medals that do not include the 2 that were just awarded at the last convocation, and you have 1 Killam Scholar. So your students are doing very, very well by metrics of scholarship success. Okay, so what I've told you is all of the things that we can easily find numbers for. These are statistics, these are metrics, and every institution has them, every program has them. But what I really would like to challenge you to think about in your breakout discussions is how do you really measure the success of a graduate program? And every institution and every unit needs their metrics because they have to have some benchmark that they have to be able to talk to and speak to. And when those benchmarks go, those numbers go up or down, I have to account for why they're going up and down. But really, is that what defines a good graduate program? And I would like you guys to think about going forward, what might some of the more intangible things be that you want to measure the success of a graduate program? And is it the number of students? Well, that's easy to get. We can all count heads, we can all count the people that are enrolled. The quality of the students. How do you measure whether or not you're getting really good students into the program? Is that the number of papers that your trainees publish? Is it the number of policies that their research results in? Number of international students. By some metrics in some programs, that's actually a measure of success. Scholarship success, you clearly have that already. Is that something you really want to be known for? National recognition. What do you want your program to look like that will put you on the map nationally and then hopefully internationally? And how do you get prospective students to want to come to your program? What do you want to be known for? And I actually did these before I actually knew exactly what Brenda was going to be talking about in the breakout sessions. And really, what do you want to be known for? And so that brings me to kind of the next aspect of this is where we are, where do we want to be? And I think to do that, we want to look at where we are nationally. And I know that Brenda's going to give you some commentary about different schools across the country and what their vision statements are and kind of some of the higher level kind of comparators. But what I wanted to show you is, and I think the ones that Brenda picked were Toronto, Mac, U of A, UBC, and McGill. Okay, so I got them. And so this is, I did not put this together. This was done by someone in the provost's office when we were putting together a new proposal for one of our graduate programs, looking at some comparisons of programs across the country. And so I have taken this. This is not comprehensive. This is a snapshot of kind of things to consider. So the University of Toronto, course-based Masters of Public Health. These are the number of credits that you need for a course-based thesis. And I'm just going to throw this out there because I'm going to compare your thesis-based masters to what the credits are. 30 credits is 10 half-course equivalents. Is that right? Divided by 3. 10 half-course equivalents. Universities do these in credits, so I've tried to make them the same so you can compare across institutions. They also have a course-based master's in biostatistics that is 12 credits and a thesis-based master's in biostatistics. But to the best of my understanding, this is geared towards more mature students that already have jobs and placements and experience. When you look at the School of Public Health at the University of Alberta, they have 250 students enrolled in any number of their Masters of Public Health program. This here is a course-based master's, quite a few more credits than at the University of Toronto, and this is the course requirements for their thesis-based masters across their different, I'm going to call them specializations because that's the most comparable terminology to what we have. UBC has a course-based Masters of Public Health, and I hope you're seeing a trend in the course-based Masters of Public Health. And it also has a thesis-based biostats, epi, health economics, and health research, all around 30 to 36 units for their coursework. And the reason I'm saying coursework is because from what I've heard from people is that students look at what their course requirements are when they're trying to decide what programs to come to. So if UBC has 2 courses and U of C has 10 courses, how does that compare, or how does that factor into a decision that a student makes? I don't know the answer to that, but I think it's something that you need to be aware of when you're starting to look at what your programs look like. McGill is the one that I could find the least amount of information on, but it seems like for a course-based program, they have a whole lot of courses that you have to take. And this is McMaster, again, 24 units, 18 units, 21, 15. Obviously more for the course-based and compared to the thesis-based. Global Health has 81 students, and the Health Research Methodology course-based masters has 42 students. So they're pretty big programs. How do we compare with respect to our coursework? A little bit less than many of the thesis-based programs, ranging anywhere from your lowest course requirement is in medical education, which is 6 half-course equivalents or 18 units, and your highest being your clinical epi and healthcare epi at 27 units apiece. So that's just to give you the easy to find what's on the website course requirements for what I think might be comparable programs across the country, and it's the biochemist trying to figure out what comparable programs are across the country. So, but hopefully you at least have kind of a snapshot of what that looks like. Okay, the next thing I want to talk to you about is the messaging and what you want to be known for and what you want future students to know about your program. And how many of you have gone to the graduate science website for the community health science program? Oh, wow, that is more than I thought. Okay, so for those of you who don't know, the Graduate Science Education Office put together some marketing promotional material. There should be, except for this table, there should be some smaller versions of this on each of your tables. And what we did is worked with the program directors, the program administrator, to have a catchphrase about what you wanted prospective students to know about the program. And what we came up with was exploring and solving problems at the intersection of health research and education for individuals and populations. And then the descriptor underneath that says, students benefit from diverse, interdisciplinary expertise of our renowned educators, working together to help you gain a more profound understanding of the multiple influences of health so that you can translate this knowledge to more effectively improving our communities. So that is what your current marketing is to prospective students. And these are the handouts that we gave at that recruitment drive that Elizabeth talked about. If you go to the program website, what you say about your program under the future student site is the Department of Community Health Sciences represents a diverse set of individual, family, and population health needs in a variety of health, education, and community settings. Students acquire foundation competencies in core areas of research and professional practice in their specialization areas. That's, in case of those that haven't gone to the website, that is what your landing page looks like for the Community Health Science program. And now the next question is, how many of you gone to the Community Health Science page on the Faculty of Graduate Studies website? Okay. So that's what the Faculty of Graduate Studies website looks like. For any of you who have not done their supervisor profile on the FGS website, please do so. About 6 months ago, they launched this new future student website, and it's absolutely fantastic to help people, future students, look for researchers and their area of interest. It takes about 5 minutes, so please, if you haven't done it and you are interested in recruiting graduate students, it's really worth your 5 minutes. But what you say on, and I put this up, so what you say on the FGS community website is a lot longer, and I'm not going to read it. And so one of the things that I would like you to do in your discussions is think about what you want that outward-facing message to be to your future students. And as I said, I'm talking about this in the context of graduate education, but this is true for your undergraduates, this is true for your residencies training program, for all of your specializations. And as pretty and beautiful as these look, we can print more. So if you decide that the messaging that we have here is not what you want your messaging to be, we can change it. And I think that it's really important to figure out what you want that to look like and how we can best work with you to get that information out there through our marketing, our website, and all of our communication channels. And that's really all I have to say. Happy to take any questions, and looking forward to a great discussion over dinner.
Just one comment for the indicators of the international. Maybe you add the number of the countries. It may be how spread geographically.
Yeah, and we can get all of that information. Like, we have so much detailed information that I just didn't want to bore you even more with. But yeah, we can look at geographically where people are coming from. Yeah.
Just be a question or a comment. So the ultimate goal is for these people to get out and get jobs in their area. And if you go to any MBA where they charge a huge tuition, you go to their website, they're going to tell you exactly what percentage of their students got employed within a certain period of time.
Yep.
And why is that not anywhere here?
Because we don't. Because we don't have that data.
But we should.
We should. Okay.
If they can collect what we can collect.
Only one health services and policy program amongst 17 or something in the country is tracked.
Well, we should be.
Well, I understand that.
So,
especially in this economy where our tuition is going up.
So it is a challenge across all graduate programs across the country. We are trying very hard to work with the alumni office to track them. We actually have a grant from the Faculty of Graduate Studies to look at not necessarily tracking our graduates, but to look at outcomes from a number of different programs. We might have a good idea. Where it falls off is kind of, we're pretty good at tracking the first step after graduation, but it's people, it's manpower, it's resources that, we have part of a person doing this off the side of their desk. It is really what it comes down to. And I think that there's lots of strategies that we're working on to try to improve this going forward, but we don't have the data. Tom?
Just want to point out that, compared to our competitors, we've made a very deliberate decision here several years ago to not actually pursue an MPH degree program. And at the same time exemplify the fact that we're into thesis-based degrees by and large. Unlike our competitors, and virtually all of them got cash cow MPHs now with scores or hundreds of students going in, and we have not gone that route. I have to think that was a good choice then. I have to think it's a good choice now. So it already differentiates us from most of our competitors. It also puts us at a disadvantage because
Money.
It's a lot different experience to train a person in a thesis-based degree and a course-based degree. Any comments about that? Is that in your view a strength? Is it something we should consider?
So
open up more programming?
So I'm going to answer this from a very pragmatic perspective, not necessarily a discipline-specific perspective. So I can't answer for you as a group whether or not the best decision for your department is to focus on thesis-based programs versus an MPH. I cannot answer that question for you. When I look at what other institutions do, and in talking to a very limited number of people, there are huge opportunities with pursuing a Master's of Public Health. Mostly in that, when you create a new program, you can create a new tuition structure, and you can actually generate revenue for your program and for your department to then help you strategically do other things that you might not otherwise be able to do.
Thank you for being honest, because one of the reasons why many of the programs have grown so large is purely and simply because they got a tuition policy where proportionate tuition is coming back to the department in question and rewards them for their size. We are not rewarded for size.
No, you are not.
And just to remember that many of those programs have trouble placing their graduates in on the position.
Yeah, and I don't have the expertise to speak to that. And that's why I think that's why I'm trying to set a stage for a conversation.
Thank you very much, Tara.